Hello, my name is Jesus Berdeja. I'm at Tennessee Oncology. I am actually very excited to talk about the new FDA indication for newly diagnosed transplant-ineligible patients from the IMROS study. I'll remind you that the IMROS study was a study of patients who were not intended for transplant or were transplant ineligible, who were randomized to isatuximab, bortezomib, lenalidomide, dexamethasone versus bortezomib, lenalidomide, dexamethasone. On that study, patients received 8 cycles of ISA VRD followed by maintenance where bortezomib was then dropped and continued ISA, lenalidomide, dexamethasone. But the primary endpoint was progression-free survival, and this was met by the study with a hazard ratio of 0.6. That means a 40% reduction in death or progression favoring the isatuximab arm. So based on this data, the FDA has approved this new quadruplet for transplant-eligible patients with newly diagnosed multiple myeloma. A reminder that, again, this study was purely for patients who intended not to proceed to transplant. It did include some frail patients, but also some fit patients. The study itself gave bortezomib twice weekly, which I think can be difficult for some of the frail patients. But I think in your practice, I think any patient that would be eligible for a quadruplet therapy, perhaps not the most frail patient where you might still consider a triplet, would be eligible for this type of combination. There actually was another study called the BENEFIT study, which looked at that at the patient population, particularly with the same quadruplet, but that was compared to ISA Len Dex. And in that study, the quadruplet again won over the triplet, but there the patients were more frail. The bortezomib was given weekly, and the patients did quite well. So I think it's one of those things where you need to decide on an individual patient whether they can proceed with the intended schedule from the IMROS study, or you may want to manipulate some of the other combination drugs, just like we do in standard of care with the bortezomib and dexamethasone and then lenalidomide dose for your patients who may be more frail. But with those adjustments, I believe all patients could benefit from this quadruplet.